with them, this gave them a framework for understanding. And once we had this framework for understanding, we also realized that we don't have the expertise. So I think I can do a reasonably good job of exposing teachers to understanding trauma, but it's only a partial understanding, and I do not know programs and systems in place that will actually enact, that we can enact to help. So I reached out to Penn State kind of through a mutual connection and a cold call to Carlo, basically, saying, here's our need. We need some expertise here. Carlo and Kristen came down to Solanco and did a bit of a study, and we're in process right now, but they have an expertise that we need. So we are in process with this. It's a mutually beneficial partnership because we basically presented a ready-made district that's wanting help, and Penn State has a public school that wants their help as well. So that is the context. We brought Penn State down, and they've been working with us. Like I said, we're in process, but I'm going to turn it over to Carlo now to talk about the relationship that we built and the process that we're going to go through. Carlo.
Thank you, Brian. Hopefully you guys don't get sick and tired of me by the end of the day. But this is, as you've heard, has been a wonderful relationship that built up from Brian identifying the need that the community has. And I hope you appreciate the context that was provided in the very beginning, because when Brian gave us a call, Chrissy and I, working together with Brian on this, we were thinking about how do we implement, an evidence-based practice or an evidence-based intervention from the get-go. And what we learned is we probably need to take a step back and really understand the context in which we will be operating under. And I think, as you already heard, Solanco had such a great system in place for responding to acute traumatic events. And as I mentioned earlier, oftentimes those in some ways are a little bit easier to understand because of this one single point event that you can understand trajectories afterwards. But when you're dealing with chronic trauma and complex trauma, it's a little bit more difficult because it manifests itself in very different symptoms or different ways that make it a little bit difficult. And as Brian had mentioned, teachers may not be equipped to handle some of those challenges, especially at older ages when kids probably are a little bit more aggressive perhaps or defiant. It becomes a little bit harder to help promote the empathy in the teachers. And so what we did then was initially, as Brian said, we engaged in a focus group with the different levels of administration and support in the schools. So we talked to administrators, principals, we talked to educational support, non-teaching staff like school psychologists, school counselors. We talked to special educators and general educators separately just to get a sense of what is going on, what's everyone's understanding of traumatic events. And as Brian had mentioned, oftentimes as a superintendent, you're the last to know. And so I think for us it was helpful to understand, making sure and ensuring anonymity in terms of what was shared with us, just to get a better understanding of what is going on before we barge in there and say, here's a package deal that you have to do this and implement this. And as Brian already mentioned, the school district's finances aren't necessarily at that high enough level that could afford some of these programs. And so I think being able to develop this and build it from the ground up in collaboration with Solanco is an excellent first step. So I'm going to go through this quickly. These are just some of the findings that we received from the interviews. We found out that perceptions of overall trauma and some related problems across the board include child factors such as mental health concerns and access to services was a big deal. Family level factors such as poverty, and again, appreciative of what Brian shared with you, that poverty is not the same anywhere you go. Even if you compare urban poverty versus rural poverty, it's not quite as simplistic, right? There are several factors, several complex factors that have to be taken into consideration. There's family instability, maltreatment, drugs and alcohol. A big issue, I think, especially in the community, was access to firearms, both for families as well as children. Not necessarily in the schools as often, but it is a concern if it's readily accessible in the community. Would it just be a matter of time before it gets brought into the schools? Lack of support, and I think the important piece here is the multi-generational problems that occur, because then as educators and education personnel, how do you address a problem that's multi-generational? Where do you even start, right? Do you start at the parent level, the child level? How can you be sure that if you enact services at a child level, that these will transfer over to the next generation? It's hard to sort of predict that. From the school level, there's increasing reliance on schools to provide more support for these students. And as Brian already mentioned, some of these supports are being put in place, and it's not enough. That taxes the education system to do a lot more than what they were intended to be to begin with, which is educate kids. And so it's a shift in model from provision of just providing education to a sort of more, in some way, case management approach. At the community level, we have ease of access to firearms again, as well as these drugs and alcohol problems. So you can appreciate a lot of the complexities in these problems that have to be taken into consideration when developing some of these programs. And I think a more important question for us in terms of feasibility is, where do we tackle the problem? We're working with the school district. At what unit would we operate under? And I'll get to that when we get to the proposed program. In terms of understanding trauma, one of the biggest things that came up time and time again is this sort of understanding of trauma. Whenever anyone said trauma, there's this ambiguous sort of notion of what trauma is. And as you heard yesterday, there are different ways that we can understand trauma, from acute to chronic and complex. And I think that, as far as knowledge, is something that has to be provided. There's also, again, the developmental considerations for traumatic events, whether it's acute or chronic, in terms of what happens when kids experience trauma early in their development versus those who experience it later on. And how do these traumatic impacts affect the kids across each of these lifespan or transition points? So time and time again, in each of these different groups, the understanding of trauma and the need for understanding of trauma and its impact on children came up, and was a very important piece of information that everyone wanted. We discussed some of the school-wide impact, such as traumatic events wiping out schools' resources. And when I say resources, in addition to financial resources, we're also talking about emotional resources, particularly for teachers. And Dr. Duvall Flynn will be talking about a lot of these secondary traumatic events, for example, and how that affects teacher practices. Issues or concerns about post-mandated reporting. Oftentimes when we hear about maltreatment in the schools, the first thing we think about is just reporting, detection, and reporting. The reality of it is that teacher will have to report if they're mandated reporters, but then the students may still be in their classrooms. And so what are some of the after-reporting supports that we can put in place? How can we support the relationship between teachers and children? This is something that, as clinicians, we sort of have to think about, because once you're a mandated reporter and make a report, sometimes the therapeutic relationship is broken and we refer them out to another clinician to continue that treatment. It's not the case with teachers, right? There's no way you could just refer the child back out to a different classroom. And so how are we careful enough to make sure that, despite these policies in place, how can we still maintain that relationship with the teacher, so that the end goal here is to be able to promote academic achievement for these children? School-wide support, again, is something that came up time and time again, as well as teacher response towards students after traumatic events, or for children who have traumatic histories. As Brian already mentioned, how do you shift the teacher's approach from what's wrong with you to what happened to you? How can I, as your teacher, help you through some of these traumatic events so that we can get to the learning process? Because if the traumatic events are still very alive and well for the child, the learning processes may still be a little bit challenging. Sorry. I think the other piece that was really important that came up again is the teacher preparedness, and I think this will be covered by Dr. Terrell Corbin as well. As far as family and community, and this is where a lot of times the educational personnel across the board, from administrators to teachers, is that this helplessness as far as what to do with the family and community factors that somehow find its way into the classroom, whether it's maltreatment occurring in the home and how those impacts are then felt in the classroom. The one piece that's important here is the cultural consideration. You know, oftentimes we talk about some of these best practices or what we know best for parenting approaches, and oftentimes these cultural norms that are present in the community may clash with what we as professionals might think of as the most optimal for families and students. And so how do we consider the cultural milieu around the community, as well as the school districts, as well as the professionals in place? When we talk to the teachers' needs around childhood trauma, the one thing that kept coming up time and time again was the knowledge about trauma. So to understand what children are going through, especially the impact on their development as well as their learning processes, and the need to understand and learn ways to be able to help children develop coping strategies when they've experienced a lot of these traumatic events, acute and chronic. Understanding trauma-informed responding and how to be sensitive to some of the children that are in the classrooms. A lot of times the teachers acknowledge and express concern that they feel like they're walking in eggshells when they know, for example, or they suspect that maltreatment is occurring in the home or that an acute event had occurred. How can you be sensitive enough to be able to approach the child without having to trigger some of the post-traumatic symptoms? The other piece that came up was building trust and rapport with students, as well as attitudes about trauma. As Brian said, do you want the student to like you and respect you as well? And so that starts with this building of the trust and the rapport with the teacher, because no matter how much skill building we put in place, if that student does not trust you as their teacher, then the learning is as Brian said, would be dead in the water for a lot of these. So at the end of the interview or the focus group question, we asked everyone, what do you want implemented to help address a lot of these traumatic events, chronic and acute? And first and foremost, everyone wanted to understand a universal definition of trauma and what signs to look for. They wanted structural changes in place to be able to address neglect specifically. As you know, with physical abuse and sexual abuse, some of these overt symptoms and signs are easier to detect. When it comes to neglect, other than a child coming in disheveled in your classroom, it's a little bit harder to detect some of the other unseen or overt behaviors. And likewise, when it comes to physical and sexual abuse, some of the more emotionally related symptoms are also harder for them to detect. What they wanted is periodic, well-planned, efficient information that's built into the current department or MTSS meetings. MTSS is the multi-tiered systems of services that I think we've all heard already, that schools are taxed in terms of the time that they can allocate to a lot of these programs. And so how can we take into account currently existing systems in place for the school so that we're not taxing it and we are able to actually come in from within the school system and the school's culture. So not separate meetings about trauma and taking time away from curriculum development and, more importantly, the teaching. Teachers needed review topics about trauma, including the warning signs, as well as a system for ongoing training for experienced and new teachers. So having this mentorship model and coaching model for teachers to be able to carry forward some of these trainings and some of these knowledge transfer. And I think this is something that oftentimes we fail to acknowledge, is how do we incorporate strengths-based or positive approaches in terms of the program? Because part of the shift in understanding what's happened to the children is to understand that there are strengths in place for them. So having understood the background and the context that we had to contend with, we talked about or thought about some of these traditional methods of implementation of programs. When used alone, these methods often do not result in use of innovation as intended. So if all we did was diffuse or disseminate information, if all we did was one-shot training deals, if all we did was pass laws, mandates, or regulations, if all we did was provide funding mechanisms or incentives, and if all we did was organize change or reorganization of the school district, then we fail. As Aldridge and Blase and Fixon said, organizational systems may overwhelm intended effects of a program. It's the system itself that we have to take into consideration, and we have to work well within the system. This rings true with my work in family therapy, that if you don't work with the whole system, working with the one individual oftentimes will result in relapse. And so it's the same true with any kind of system, and you're talking about a school system here, and so we need to work well within the system to be able to instill some of these changes. And so there's a research to practice gap between research knowledge of these effective interventions and services that are received by people who could potentially benefit from these research-based interventions. We all know, I'm probably preaching to the choir here when I say that, evidence-based practices, are important because their effects have been shown to be effective for those in need. But the translation from research to practice has a lag time of greater than 20 years. And so what we need to do is address this gap. So the framework that we use to be able to design and begin this collaborative design of the program is to use an applied implementation science framework. It's a core set of strategies that's needed for effective implementation from the ground up. The National Implementation Research Network, or NIRN, organized these within the active implementation framework of these 5 frameworks: usable interventions, implementation stages, implementation drivers, implementation teams, and improvement cycles. And you can get a lot of this information from the website that I've posted on here. And I'd be more than happy to share the slides too, so you don't have to, that's a lot of letters and characters to put down. So you'll have that on hand. But just a brief overview, since I think I only have 5 minutes left, is in terms of starting this out, I'll start with framework 2, which is implementation stages. As you can see on here, there's this recursive 4-step stages in designing and in implementing a program. So we started out with the exploration stage in this case, where so the goal of the exploration stage is to examine the degree to which a particular program or an innovative design program that's in process meets the school or the district's needs, and whether implementation is actually feasible. And we started that by conducting the focus group, presenting back our results to the community to understand, or to let them know that this is what we understood, and to confirm that we actually have an understanding of the community's needs, and to ensure that we do have a viable program and partnership. And the next framework here is to identify implementation drivers. There are 3 types: competency, organization, and leadership drivers. And when I say leadership here, it's not necessarily the role itself, but the strategies that a leader can employ to make sure that you have support from the top down as well as the ground up. And then the next step would be forming implementation teams. And so after we did the presentation, what we're hoping to do is have a school-based advisory board that can work with us in terms of feedback from the template of a program that I'll share briefly with you guys, so that we have some of these implementation teams and drivers to ensure feasibility and implementation and sustainability of the program. So this is where Penn State fits the needs of the Solanco School District. We propose this multi-tiered model for service delivery. Again, MTSS in the triangle. You're all familiar with this. At Tier 1, we'll have a universal screening for trauma-related behaviors, live training that will be implemented and rolled out or phased in. That way we would have a cohort of teachers that would be able to receive the training at this stage and compared to those who are in the wait list. Tier 2 will have booster trainings as well as remote teacher consultation around trauma and student performance. We would, in this tier, use a classroom checkup model, which is a sort of motivational interviewing based model that would allow teachers to have ongoing support, so that they just don't have this one-shot live training, that they would have ongoing support, remote and with booster trainings, as well as if needed, we could come back and do live training so that the teachers can actually consult with us and not be left alone. Tier 3 would be community referral and care coordination that would, using already existing systems in place, we would coordinate with some of the community providers needed for the most severe behavioral problems in the schools. So I think I see the cane coming up. It's about to take me off the stage. So I will I'll end with this slide, which is some of the proposed training modules based on what you've read in terms of what we found in the needs assessment for the school district. These are some of the modules that we would co-develop as we move forward. So first and foremost, the understanding of trauma and what they are, some of the developmental impacts of trauma and how that would impact learning. And then I think one of the things that clearly resonated with everyone is how do we translate some of this knowledge into practice? Because I think if we stay in the theory level, we can't assume that it's an easy transition to then teaching strategies in the classroom, and that's a big gap, and that's a big jump. And so I think developing the third module, which is how do we then develop teaching strategies that would bring in some of these understanding of trauma and understanding its impact on behavior and learning, and that I think would be the next important piece of information. So I will end it right there. We probably don't have enough time for questions. So.
Go ahead and put your questions on slido.com so that you don't forget them, and we'll get to them at the end of the presentations. I'd like to invite Dr. Susan Stone up for the next talk. Dr. Stone is an associate professor in the Catherine Mary and Eileen Claire Hutto Chair for Social Services in Public Education at the University of California at Berkeley. She received her BA in Behavioral Science and her AM and PhD degrees from the School of Social Service Administration at the University of Chicago. Her substantive area of interest lies in the intersection of social welfare and education. She's specifically interested in the educational experiences of underserved student subgroups, how school organizational and institutional features shape student experiences in schools, the organization and arrangement of school-based social service delivery systems, and the attributes of school social work practice and its relationship to academic performance. Her research typically draws upon school administrative data sources with attention to methods to extract causally informative information from observational data sources. I'd like to welcome Dr. Susan Stone.
Just do this.
I'll let you do it. Thank you.
Oh, no. Sorry.
Thank you so much. I wonder, okay, I think that you can hear me there. This is my first time visiting Penn State, and I have to say, first of all, that it's a truly lovely campus. I actually feel like I'm going to be a bit of a Debbie Downer. I love the exemplars that you brought to the table. And what I'm going to do today is maybe suggest some reasons why this kind of work is not our usual practice, or what really from a meta view are the institutional barriers to such, I would say, authentic integrated work, where teacher relationships are at the core of what we do. I think I'm going to do that. Okay. One of, I think, a useful frame to think about the issue of maltreatment is through the so-called, the lens of so-called wicked problems. Rattel and Weber are basically social planners who made a distinction between problems or issues that are tame versus problems or issues that are wicked, particularly looking forward to policy solutions. And in this framework, I want to caution that tame doesn't necessarily mean simple but that the problem itself is tightly identifiable. And a